the number of influenza infections recorded across the country has seen a 65% drop on last year. However, experts are saying we are not quite yet out of the woods.
With the peak of the flu season still to come, there are warnings that communities shouldn't become complacent. Professor Meru Sheel is an epidemiologist from the University of Sydney and joins us now live. Meru, hi there. What's happening then out there and why is it happening?
Hi, good morning, Lorna. Thanks for having me. Yes, we are observing a lower activity of influenza at the time of the year where we are compared to the previous years. But this is not unusual. COVID's just thrown things around a little bit, made it interesting and a little bit confusing, I guess, for many people in terms of, when we were seeing influenza activity. So essentially in the last couple of years, the data suggests that we're at a lower point than the 5-year average, but the last 5 years also saw the emergence of COVID. And following COVID, we've just seen influenza and many other respiratory diseases become a little bit more unpredictable. So that's probably one of the reasons. And we've seen influenza activity towards the end of last year with the emergence of the Super K strain, which meant that we saw a little bit of summer infections. So there's likely immunity in the population, but also we've just started seeing the real drop in temperature. We had an unexpectedly warm April, May in Australia. The temperatures are only now dropping and winter is officially only now starting. So it's not uncommon for us to see the peak later in the year, so say about July and August. And so that's one of the reasons why we don't think it's something that we can just be say that it's influenza's done for the year and be complacent about it. And I guess looking back historically, 2017 was one of the years where we saw very, very what we call a bumper year for flu. And in August is when we saw the peak of activity. So pre-COVID, 2017 and 2019 were the real two big years. And they were all both July, August peaks. So it's not uncommon.
Right, that's interesting. What, Meru, made last year, 2025, so bad for influenza?
Yeah, so influenza is one of those complex and interesting viruses because it evolves every year. There's a change a little bit. And what we also think happened is basically, there's been an immunity debt over the years because of COVID. There was a long time where we had this, the public health social measures, which led to mass shutdowns or lockdowns, which led to, I guess, an immunity gap. But also there's been a drop in vaccination over the years. And that annual vaccination also helps build up immunity in the population. So if we're not seeing as much uptake of vaccination, there are more people who are susceptible. So that's why it's really important for people to get vaccinated and not take these numbers as a sign that, we're not seeing enough influenza activity, so we shouldn't get vaccinated. It's just giving people time to get vaccinated, and our coverage is nowhere where it should be, ideally, for influenza.
Yeah, I mean, interesting to read that only 16% of 18 to 50-year-olds have had a flu jab this year. That potentially is a problem, is it not?
Absolutely. I think, it's really important for the elderly, for the children, and for everybody really to get vaccinated. We know the highest risk groups are the elderly as well as the children and pregnant women. They absolutely should get vaccinated, but the entire population, because it's beneficial for individuals, but it's also beneficial for others around them. Influenza vaccine has that really strong herd effect. It protects people in households. There are studies and data showing that it protects people in households if one person gets influenza, but also broader population and individuals as well. So absolutely.